Later onset disease is a little bit wrong because these are genetic diseases. So by their very nature, they start when you're born and they're present your whole life. It's just in later onset disease, you have enough spare copies of the gene so you can delay that onset of the disease until later in life. And again, when you have more copies, it's going to be slower, it's going to be more gradual in its decline. You're still going to get the same presentation, that is the weakness in the muscles, the difficulty running, the difficulty getting up the stairs. You may have problems reaching something on the top shelf in your kitchen cabinet because of the shoulder weakness. But it will present more with that. It will be milder. They're less likely to have as much of the swallowing or the speech changes as somebody who's younger. But these things can be there and they can be disabling and they need to be treated. The age and onset is a function of the type. And we had talked about the type 1s that can present at birth, the type 2s, where you start seeing it at 6 months. When you start getting to the types 3s and 4s, they can present later, as much as 16 years of age, 20. There's some patients that have been reported to present at 30 or 40 years old with some of the more of the type 4s where they have enough of this SMN2 so that it can compensate and it doesn't occur later in life. So they can present, these patients can present at any age with SMA. It's just when it presents earlier, it means it's more severe disease.
The later the symptoms occur, the broader the differential diagnosis are. You have other motor neuron disease like familiary forms of amyotrophic lateral sclerosis, which has to be determined when proximal tetraparesis occurs. And on the other hand, in the early onset forms, you have also think about congenital myopathies, which may have similar symptoms, and that's the reason why the genetic testing is so important. For an experienced child neurologist, diagnosis is typically not that difficult because during childhood, the SMA is one of the commonest forms of neuromuscular diseases, especially when severe tetraparesis occurs. During adulthood, it can take some time, probably some years, if patients don't have access to a neuromuscular expert center.